Kia ora, welcome to HINZ 2013. It's all about engaged patients this year, and Genai is totally focused on health in the home, keeping people out of hospital. We've got a raft of technologies, a whole suite of vendors, including Vigil Technologies, Medimap, AMS, HSA Global, SHI Global, all here on our stand, helping us integrate applications with our platform technologies, our cloud technologies, our connected health suite of technologies to keep people safe in their homes.
Well, I think the critical issue is that the patient, any information about the patient, probably in a sampled form, needs to be available to their lead clinician, who's typically the GP.
Yes.
And so it's very important that the GP is actively managing the environment with the patient. So the patient not only has got measurements being taken, but there are thresholds set which are defined by the GP, because the GP knows what should be, what will be abnormal and what won't be abnormal for that particular patient, and it is patient specific. So you need the information with the clinician, with the patient, and so that everybody can actually agree on what's good and what's bad.
Well, I think your stand this year is quite exciting because it's as I said, besides being another string to your bow in the whole telehealth arena, it demonstrates the move we're seeing towards patients being more engaged in management of their own healthcare and the dissemination of the delivery of healthcare out into the community. So from a DHB or a public health sector perspective, that could actually enable earlier release of patients back into their homes, because with a product like Vigil, it makes it potentially safer to do so earlier, because they can maintain that connection back into the hospital or their GP or whatever. From my perspective, it's great to see that connected health is working in that way, that it's basically creating the mass is creating its own gravity. We're seeing the service providers and customers coming together in the way that the National Health IT Board intended in the first place.
Yeah, thanks Joe, and appreciate the opportunity to come and present at the conference. The key for any strategy within health is to focus on the New Zealand triple aim, put quality first, then look at the cost and the access for our populations. One of the enablers of this pilot has been to robustly test the methodology around using tablet and electronic form technology, and we're actually testing it real life, so we're testing it with patients and with our clinical staff, particularly our nursing and community allied health teams. So by being able to actually use it on patients in a live trial adds huge value, because it means the results that we get from that, we can roll it out if it's a success, but at the same time, because it's a live trial, we can iron out all the problems that we're having as we go, as opposed to waiting till the conclusion and then changing it. I think you'll find any hospital or district health board will embrace that technology, because strategies to keep patients out of hospital is where the focus needs to be. We all know that healthcare is the most costly when delivered in a hospital setting, so if we can be enabled to provide technology to our patients that comes at less cost than a hospital stay, I am sure you'd have no hesitation in being able to get a great deal of buy-in from many clinical staff up and down the country. We know it happens internationally. We've often been shown technologies that are going on in other countries, and it would be great to see New Zealand get on board and actually empower the patients to have some ownership over their care as well.